Good morning, members.
Good morning. Good morning.
Morning to you.
Good to see all of us turning up in large numbers. We are waiting for our speaker, who will be joining shortly. Just a minute, I respond to her call. So, colleagues, the trainer is joining. She had issues with technology, so let's bear with her. Let's give her a minute. It's good to see all of us joining in large numbers. My name is Patrick Okwara from Amref International University. I'm actually the secretariat head for the PHC Congress. So as we wait for the trainer to come, I want to quickly just show you what this is all about. So let me share my screen so that I can be able to use this time to show you what this training is all about. So Amref International University, together with her partners. So allow me to go back a bit to see who these partners are. Yeah, together with her partners that I want to be able to show here, are planning a primary healthcare conference that's going to be upcoming sometime later in the month of November, from 29th to 1st of December. So these are the partners that Amref International University is partnering with for this conference. We are calling it a congress. So the abstract training today regards this congress. It's meant to help us to be able to put in watertight abstracts that can be accepted for the Congress during the meeting. So that is the essence of this training today. So those of us who are joining, I know we have members joining from different places, from the Jaramogi Oginga Odinga University of Science and Technology, and also Amref International University. Welcome, karibuni sana. So as you can see, I hope you can be able to see my screen. You can be able to see my screen. So, so those are the Congress dates, 29 December to 1st December, 29 November to 1st of December, 2023. So the theme of this Congress is aligning practice to evidence in strengthening PHC for lasting health change in Africa. So if you want to access this website, you just type www.phccongress.com to be able to know much about this Congress. So we are hoping that you're going to be following this Congress. So you'll be able to see the background of the Congress there, which you can be able to read about, see the genesis of it from the Alma Ata Declaration. Then we have the various tracks here. Actually, we have up to 5 sub-themes with various tracks, okay? 5 sub-themes. For example, the sub-theme number 1 is evidence-based community approaches, models that strengthen equitable access to PHC. Then we have the various tracks here. Then we have another sub-theme here, and the various sub-tracks here. We have sub-theme number 3 with up to another 5 tracks, as you can see. Then we have a sub-theme number 4 on interventions to leverage emerging global issues, the PHC, with the various tracks. So for you, what you need to know is that the call for abstracts is now out. We are now receiving abstracts for this Congress. So once you come to this website, again, which is phccongress.com, you can be able to come to this place of, if you click here, it will take you to the submission portal. So you can be able to go to the submission portal here, where you can be able to click and be able to start the submission process. So this, the portal will ask you first of all to register with your email and create a password so that you can now begin to know who we are expecting an abstract from. So once you register, create your own password, you can now begin the registration process by being able to select any of those. So let's mute. Yvonne Lanko, you can let me know when the trainer is there, so that you can be able to welcome them. Yeah. So once you come here, Habjam, please mute. Habjam, please mute. Habjam, please mute. Okay. Yeah, so once you come to this portal, you can now be able to select the type of the abstract here, as you can see, whether it's scientific or best practice. And that's going to be the gist of the today's training. The trainer is going to be showing us how to package both the scientific or best practice abstracts. Then you can be able to select among the 5 sub-themes that we have. You put your title, which should not be more than 25 words. You put your abstract, which should not be more than 300 words. And then you'll be able to come here and choose whether you want to present it orally or by way of post. Okay. And then you'll be able to put in your details and also include those of your co-authors for the abstract. Guys, let's mute, please. And then you'll also be able to do what? To fill in to express that you have no conflict of interest with the abstract. So in a nutshell, that is the whole essence why we are here. We are here in preparation for the Congress, the Congress, which is upcoming in November. So the essence of today's meeting is to help us know how to be able to package the various abstracts that are due the second week of July, the specific 15th of July. So without further ado, I'm hoping that the trainer is here. Yvonne Lango, is she here?
Hi, Patrick. I can see her in the list, so I don't know if she's physically here. Maybe you can just ask her.
Okay.
Oh, good morning, Patrick. I'm here.
Oh, thank you. So welcome, Yvonne. What I have done, I have taken the audience through what the today's training is all about. I've shared about the upcoming Congress, the dates, the theme of it, the sub-themes, and the various tracks. I have also shown them how they can be able to register and initiate the abstract submission process, and also how to be able to access the abstract submission portal by going to phc.com. So without further ado, I want to welcome our director. I wonder whether she's here, Dr. Alice Lakati. So she's not in yet, but I think I can be able to hand over to our trainer, Yvonne. So for the members who are here, please let's mute our, let's mute Abraham Kiprono, please mute. Let's mute, thank you. Yeah, so Yvonne Opanga, the speaker for today's abstract training, is a staff at Amref Health Africa in Kenya. She's actually a research manager there with a host of experience in public health, published quite a lot. And we have the pleasure to have her share with us tips of how to put together compelling abstracts that can be accepted for an international PHC a conference. Yvonne, the floor is yours. Take it over.
All right. Yeah. Thank you so much, Patrick. I'm humbled, and thanks for the great introduction. So yes, today we're excited to have a session around how to write abstracts. And here we'll be focusing a lot more on what are best practice abstracts, what are scientific abstracts, what's the difference, and how can you package to ensure that your abstract is accepted, and then what are some of the tips you need to consider. So without wasting time, because I know you're starting at 10:15, I'm hoping to take at least the next 1 hour to be able to just share insights on how best we can write abstract. So allow me to put off my video because of maybe internet interruptions that may occur, and then we can continue. So Patrick, kindly confirm that you're able to see the slides.
Yes, very well, Yvonne.
All right, thank you. So as Patrick has taken you through the Congress, we hope to hold the Congress, the first primary healthcare Congress. And what I'll just start by talking to us about is maybe looking at defining what an abstract is. I know most of us have an idea. Then looking at different types of abstracts, and then we could discuss at least the various types of abstracts that we expect to see, both scientific and best practice. And then looking at good abstract writing practices. How do you write your abstract to ensure that it's quality? A few common mistakes and some of the things that we may expect from reviewers. So in terms of defining what an abstract is, it's actually a summary of either a research article or a project that you're implementing. If you're a student, it could be a summary of your thesis, or it could be a summary of some content that you want to present in a conference. And usually for an abstract, it includes all important details that then would either be part of a project, part of a research article, and it's more of a summary of what one wants to present. So when one looks at your abstract, usually they have a clear understanding of either what your project is about or what your study is about. So by just going through your abstract, someone is able to pick what is this. Kindly mute.
Okay.
Maybe Patrick, can we get the opportunity to mute everyone? That would really help.
Yes, Yvonne, on it.
Because that would help.
Many of our subject activities.
All right, thanks a lot. Yeah, so remember, whatever abstracts you're going to write, they're going to be presented to the reviewer. So if the reviewer goes through your abstract, the abstract is supposed to give actually adequate information that would speak to your project or to the study that you intend to do. So there are various types of abstracts. And first of all, we can start with the main two categories that we'll be discussing today. That is a scientific abstract and a best practice abstract, and I'll talk about that in a short while. We also have thesis abstracts, especially for students. Whenever you're doing your thesis, you have like the first page that summarizes what your thesis is. And then you also have article abstracts. This, for example, if you're submitting a paper to a journal, you're always required to develop an abstract that would summarize what exactly the paper is about. There's also abstract for calls for proposals, but then particularly for today, we're going to focus on. Okay, we're having a lot of interruption. All right, thanks for that. So today we are going to focus on abstracts that are presented in a conference, not the ones that probably you write in your academic work or in your project work. So for an abstract that is submitted for a conference, usually it has to be a summary of the presentation that you're going to make. So as you think about primary healthcare and you've seen the various tracks that we have, it's good for you to think through before you even start preparing your abstract. What exactly am I going to present? What story or narrative am I going to tell the audience? And then you summarize that. So it could be an abstract from either a project that you've been able to implement and probably you've identified an innovation that has worked well, or it could be a study that you conducted and you want to present your results. So that particular abstract conference would summarize the presentation that you're going to make. And then it always has to respond to the conference or workshop theme. And for this particular one, if you look at the theme that you have for the PHC Congress, it means that whenever you're developing your abstract, it has to align to the theme that is being presented and the various sub-themes. And then it should be short, at least 250 to 300 words. And it should be submitted ahead of the conference following a call for abstract. And I think Patrick has already alluded to that and mentioned that the call of abstracts is actually out, and by the second week of July, I think the call will be closed. So we have that leeway between now and mid of July to be able to develop our abstracts adequately. And that's why we have this training. And then the abstract should bring out the value of your presentation for the conference, because the way you present your abstract will determine whether people would listen to you or people would switch off during the presentation that you're making. So it's usually very important for you to find out what is the key message that I want to present in this abstract. And it should be appealing to your audience such that if I read this, it's either something new, some new information that you want to share, or you want to share about or describe a new innovation that has worked very well in primary healthcare. So it has to be something that, you know, would be quite appealing to the audience that will be listening to you as you do the presentation. So other than the two types, scientific and abstract conference, they could be further categorized into, number one, an oral presentation. And this is where you present an abstract and then it's accepted for oral presentation. So you have an opportunity to present before people. We also have oral lightning presentations, which are usually, yeah, it's an oral presentation, but you're given something like 10 minutes to present your abstract. We also have both poster presentations and e-poster presentation. So this is whereby you develop a poster, and then there's some congresses where probably the poster will be pasted on a board somewhere and do the presentation, or it could be an e-poster where you present it virtually. And sometimes we have also recorded presentations where someone would present their abstract in form of a video. So based on what is required, you could either get an oral presentation, a poster presentation. But if you look at our call for abstracts, I think we have only those two, oral and poster presentations. So in terms of abstract writing styles, and just maybe going further to just look at the various types of abstracts, there's a way in which when you're writing your abstract, the style matters or could define the type of abstract you're writing. And here we are looking at maybe 5 types. We have what we call a structured abstract. And a structured abstract is where you have an abstract. When the call for abstract comes, there's subtitles that you need to write to. So you'll have maybe a place where they request you to write maybe a background. There's that subtitle of background, so you feed in the information. There's also maybe methodology, and then you feed in the information, the results, and then the conclusions and recommendations. But you also have a block abstract where you write everything in continuous prose. So then it becomes one paragraph that explains everything. So usually, if you look at most of the abstracts requested, it's either structured or blocked. And if you look at our call for abstracts, the one that Patrick just shared, it's more of a structured abstract because they expect you to write to the subtitles that they have indicated. We also have conferences that require us, especially in the digital era, require us to develop graphical abstracts where you don't have words, but maybe you have infographics and you're just talking to those particular infographics, and we call those graphical abstracts. Sometimes if you look at the higher international conferences, they also maybe have tweetable abstracts. So you have like a tweet, and that tweet becomes your point of discussion and presentation. And you also have video abstracts. So as we write our abstracts, it's important for us to ask ourselves these questions. The first one would be why was the intervention or the study that I want to present conducted? So you should have like a reason behind you conducting the study or you presenting the best practice that you want to present. Then how was it conducted or implemented? So if it's an intervention, it's important you have in mind the methodologies or the processes that were entailed in either implementing the intervention. And then for a study, probably you'll have to describe the methodologies. And then what were the key findings, either findings out of the implementation of the intervention, innovation, or the best practice you want to talk about, or the key findings from the study. And then the last bit is, how can the findings be applied moving forward? So these are the 4 critical questions that you need to have in mind as you develop your abstract. So I'll further discuss a little bit around best practice abstract. But before I get there, I'd just like us to maybe have a clear understanding is what is a best practice? If someone talks about a best practice, what exactly do we mean? So a best practice is actually, it could be a technique, it could be a method, it could be an innovation, or it could be knowledge that is generated either through research. And this particular methodology, this particular innovation has actually led to the desired results. And this should happen either in a specific situation or specific context. And I can give an example of maybe in the context of primary healthcare, we have examples of models that have worked. For example, in nomadic context, we have what you call the One Health model that has worked really well. So it becomes like a best practice that someone can actually present. And then usually the best practice is related to implementation of a program, a project, or maybe if you're looking at a policy, what has worked best in the implementation of a certain policy that was put across. And then usually for this particular, for you to call it a best practice, then also it has to sort of inform solutions to some of the problems that were identified. So even as we write our abstract, we need to be asking ourselves, as I'm presenting maybe this best practice, what problem was this best practice intended to address? And then sometimes people look at best practices in terms of things that have worked well. However, generally, when you talk about best practices, it's never about perfection. It's never about what has worked well. We always look at both sides, what worked well and what did not. For example, if you're implementing a One Health model in Mandera County, you want to bring out lessons in terms of what made that model work well and why did it work well. And it's also important for you to look at what did not work and why didn't it work and how was it addressed. So as we write our abstracts, when you're describing maybe interventions, it's important for us to look at both sides so that if someone were to pick this and scale up to another area, they can pick lessons that can be applied to another area, but even learning from the challenges that you went through in the process of implementation. So that is ideally what we define as a best practice. So when you talk about best practices or best practice abstracts, it should touch on maybe innovations, it could be interventions that you've implemented and they have worked and have resulted into certain results. But as much as we're saying, as much as you're presenting what has worked well, it's always good for you to also showcase what did not work and why. Then if you look at the WHO guidelines in terms of what defines a best practice, this could be a very good criteria that can guide us in terms of identifying what best practice we want to present in the Congress. So there's a certain criteria, and number one, it's effectiveness. So as you think about the model, as you think about an innovation you want to write about, you need to ask yourself, did this model work? Did it achieve the results that intended? For example, if the One Health model was to improve maternal health or child health or nutrition status by maybe providing those services in an area that is accessible to the people, then when you look at effectiveness and as you present your results, you need to tell us, did this model eventually contribute to improving the nutrition indicators that you wanted to look at? Then the other bit is around efficiency. So if you're looking at it from a best practice perspective, it has to be a model or an innovation that produced results with reasonable level of resources and time. And this is very important as it informs aspects of scale up, because for someone to scale up something, they need to find out how much, for example, was used to implement this One Health model and how long did it take? Yeah, so that if they are to pick it up and implement in another area, that becomes something critical. Then of course, relevance, and here relevance, it should be relevant to the health problem that you wanted to address. So if you want to address nutrition, of course, as you model your One Health implementation activities, you include nutrition activities and you want to find out, did this model help address, or rather through the use of these activities, did we achieve the objectives that we had before? Other than that, there has to be ethical soundness. And this means that whatever best practice you're presenting has to be ethical in terms of implementing, like there's no discrimination of certain groups of people, there's no harm caused to certain groups of people, and any other ethical components that we may come across as we do implementation. So it must respect human beings, and in that particular process, then we have to ensure that whatever it is that you're presenting does not pose risk to human beings. Then issues around sustainability, possibility of duplication, involvement of partners, issues around community involvement and political involvement are also key. So when you look at the best practice that you'd want to present, or even an intervention that you'd want to present as a best practice, it has to at least meet some of these criteria. And key to them are usually the first three: effectiveness, efficiency, relevance, and also a strong component around ethical soundness. So then what goes into a best practice abstract? So there are 5 main components that, even as you think about writing, needs to be very clear. Number 1, you have to be very clear. What is that best practice that you want to talk about to the audience in a conference? Then number 2, you have to tell us, why was the best practice implemented? So there has to be a problem that you're trying to solve by introducing that particular intervention or model. So that's what you bring out. Then number 2, how was the best practice implemented? And here you really need to bring about maybe key activities that were undertaken, processes, whether there were any resources that were required. It's important for that to come out. Then what were the key findings or lessons learned? So in the process of implementation, did you learn anything? What worked, what did not work? And eventually, what were the key findings? Did you achieve whatever it is that you wanted to achieve? And then number 5, how and where can these findings be applied? And this is very important, because anytime you talk about a best practice, end goal is usually for you to scale up to another area. So it informs maybe how this particular model, how this particular intervention can be scaled up to other different areas. So this is what probably you may want to bring out in terms of the results achieved. If your model was able to improve nutrition status, can it be, if you're doing it in Mandera, can the similar model be maybe applied in Garissa County, which has somehow similar characteristics? So these are 5 critical areas. Number 1, what is that best practice? So as you write, it really needs to come out. Why was it implemented? How was it implemented? What were the lessons learned or key findings? And then lastly, the ability of the applicability of this particular best practice in different settings. So having said that, then we could go to the structure of a best practice paper. So if you choose maybe to write something from the interventions you're implementing, then a best practice abstract will be the best. And it has quite a number of sections. And number 1, it's the title. Then you have what you call preliminaries, and I'll talk about that. There has to be at least a background that brings out the issues. There has to be a section where you describe the intervention, talk about what the intervention is, and how it was implemented. Then it has findings and lessons learned, where you talk about both what worked and what did not work and why, and then have your recommendations and next steps. So those are the key main components that would go into a best practice abstract. So just looking at each of them, how should the title be presented? So the title should be short, it should be specific. There has to be some form of representativeness, and it has to be informative. And as you write your title, it has to answer these 4 questions. What in terms of, what is that model? What is that best practice? At least it has to appear somewhere in your title. Who did you target, or who are the beneficiaries? Whether it's mothers, whether it's children, whether it's adolescents, that has to come out clearly. And where was this implemented? The reason why we insist on making it clear why it was implemented, it's because you find that best practices usually would work, or you'd find that maybe a certain best practice works well in a certain context, but may not work well in another one. So it's always important, so that when people try to maybe understand your results, they understand it best on that particular context. So where could be either a certain county where you did the study, if it's a school, if it's a certain hospital, then it has to appear. The how, it could be the approach that you used. And an example could be, for example, a good title could be like implementation of the One Health model in Mandera County to improve nutrition status of maybe pregnant women. That could be an example of an abstract title. And then it shouldn't be catchy, one that if I read, then I'll be keen to want to learn more and read your abstract to understand more. And then usually for a good title, it should be less than 20 words. We try to avoid longer titles. So it could be between 12 to 20 words. And then it should capture the issue of the problem. And that's what we're saying, the word should really come out very well. And it should provide the indication of the target population and area. So how you define or how you write your title, it's very critical because that becomes the entry point. Remember, all these abstracts that you're going to submit are going to go through a review process. So the way you've written your title would either make a reviewer interested in reading your abstract or not. So it becomes like a mini advertisement of your work. Is it something that would make probably the audience get interested to listen to this? So try as much as you can to be creative with your title. And as much as you're going to be creative, let us also be objective to answer the what, who, where, and how questions. So as you write your abstract title, there are key things that you need to also focus on. Number one, if you read your title, you need to ask yourself, do you get a clear sense of the paper from the title? So if I read your title, for example, does it speak to, does it give me a sort of sense of what your paper would be about? Then does it give an indication of the approach that you used? And if it's a best practice, does it really bring out this best practice? Does it have an original contribution in terms of whatever it is that you're presenting? Originality, again, is always very important as we do abstract. So even as I read your title, I have to guess, is this something unique? Something that maybe has not been implemented in this context and you're bringing it out, that needs to come out well. And does the title make a reader want to read on your work and maybe come and listen to your presentation? Very critical questions that we need to ask ourselves as we write the abstract title. Then the second section is about the preliminaries, and these are key things that are required. And often for the preliminaries, they would be specified in the call for abstract. And the first thing you need to look at is the theme. So you have to ensure as you write your abstract, you have that theme clear, and especially the sub-themes, because we have, like, for example, about 5 sub-themes. So you need to clarify, where does your abstract lie? Which sub-theme does your abstract sort of address? And then you need to have the listing of all authors. So you could start with the lead author, who sometimes is the presenting author. And then the way you write it, you start with their surname, and then of course the other name. However, this would depend on how you're guided by the call for abstracts. Usually in abstract, we avoid using titles, like for example, doctor, professor. This is usually acknowledged during the presentation stage, but as you write, sometimes it's good practice to minimize titles. Then it's important for you to include your institution of affiliation, whether it's AMREF International University or AMREF Health Africa. It's really important. And then it's always important, again, to specify who of the authors will present, because sometimes you find the lead author is not the presenting author. So it's always good for you to clarify that. Then it's also good for you to clarify among the list of authors, who should the correspondent or the feedback from the reviewers go to. So include an email address and telephone number, so that in case contacts need to be made, then they reach out to this particular group of people. So these are like, maybe I could call them generic guidelines. However, always read the call for abstract to identify what sort of information do they need that could be included in the preliminaries. Then the background, how should the best background for the best practice look like? So number one, it should bring out the context and the justification of the best practice. And this is where we talked about the what. What is the problem that is being addressed? Who does it affect, and how does it affect them? And what is the impact? For example, if you're talking about One Health, and One Health model is usually, focuses on more of that interrelationship between animals, human, and the environment. So you want to tell us where exactly is the problem? Is it that you're getting a lot of maybe diseases that are being seen in animals transferred to people, and you want to come up with a model to be able to present this? Is it that you're seeing a lot of cases of antimicrobial resistance, and probably this is a result of that correlation between animals and human beings? So you really need to bring out the problem. Also include how the problem has been addressed in the past. For example, if you have a problem of malnutrition and you have a model that you want to present on, you need to tell us this problem within this area. Are there other interventions that have been implemented in the past, and why haven't they worked, so that you justify the need for you to now, talk about your best practice, because that best practice has to fill some gap that was identified before. And then it also needs, as I said, it needs to bring out the gaps that your best practice will address. And as you talk about all this, it's important for you to now tell us, as the last statement, what is the objective, or what is the purpose of the abstract or the paper you want to present? Is it that you want to highlight maybe what has worked, or you want to talk about lessons learned, or maybe you just want to talk about the processes of implementing a certain model? For example, if you're talking about digital solutions, you could even do a simple paper that describes the process within which you develop the app and how you are able to validate it. So as you write your abstract, it's important that you find out, or you ask yourself, what is the main message that I want to pass across to the audience? Is it talking about a certain process, maybe of implementing that model of best practice, or is it talking about the results of this particular model, or is it a combination of both? It's really important for that to come out. And then, of course, sometimes good practice to include literature review that just shows about issues to do with the context, and maybe a justification of your best practice. But one of the things I want to note is, as you do this, even as you include information from literature within an abstract, we do not reference, but we usually would include references as we do the presentation. So take cognizance of that. And then, how do you define now your intervention, or how do you describe your intervention or the implementation process? So number one, you have to be very clear. What is this intervention, or what is this best practice or model that I want to talk about? Yeah. So if the model is One Health model, that should really come out clearly. And as you describe this model, you have to tie it to the problem that you've raised or you brought out in the background. Then it's good for you to highlight who has been targeted in the implementation, whether it's maybe children under 5, whether it's mothers, depending on the particular best practice you want to share. Where was it implemented? Again, I talked about the importance of context. How was it implemented? And this is where a lot is required when you're bringing out this description, because when I read this component about how it was implemented, I have to have, like, as a reviewer, I have to have a clear picture of how you went about in terms of the stepwise approach. What process did you start with? And eventually, where did you end at? So you have to clearly describe the pathways of implementation. You also have to talk about the main activities that you undertook for that particular model to work. Did you train people? Did you work with maybe community health volunteers? How did you engage them? Did you work with other stakeholders? How did you engage them? Did you do any form of trainings? How many trainings did you do? So you have to have, like, a clear description of the activities that were undertaken in implementing that best practice. And then it's good for us to also include when that best practice was implemented, because sometimes when we do, like, interpretation, or when people listen to you, if it's something that was done long time ago, probably it has been surpassed with time. So it's always good to bring out that component. When was it implemented in terms of the year, so that then someone can put context to it. Then who are the key implementers and what resources were required? So that then, as I read through your model, it's important that I have this clearly laid out, especially for purposes of scale up. If you have maybe a donor who is interested, as you do your presentation and they're interested in putting money into the model and scaling it up to another region, after your presentation, they should actually have that clear picture. So you make sure that you're succinct as possible, but you also include the details that are required. Then in terms of findings and lessons learned, here is where we present the results. So it's a little bit different, and we'll compare the scientific and best practice, and you'll see how this comes out. So for the best practice, you want to tell us what were the achievements. Remember, as you start, you're telling us about the main problem that you want to address. So here, as a review, I'll be interested to find out, did this model really address the problem? And if it addressed the problem, to what extent did it address? And this is where it will be important for you to maybe tell us, give us some data that either shows the trends or shows any changes in the outcomes that you intended to measure. And even as we look at data, remember this is programmatic data, and it could be data either that you've collected through the day-to-day monitoring of the program, or maybe through an evaluation that you have conducted. So it's important for you to highlight that. But in addition, because you find that data is mostly quantitative, but you also want to find the qualitative side of things. If you had these achievements and the data says that your model really contributed to improving nutrition outcomes, then you want to find out what exactly worked well and what facilitated this. So it's important for you to maybe just bring out key lessons learned, and that is really information in form of qualitative. Maybe you can tell us it worked because we engaged the communities, or it worked because the county had buy-in. So all those reasons, all those lessons that you're picking from the process of implementation that led to achievements of your results, it's good for you to bring them out. And again, as I said, it's important, let's not shy away from telling us what did not work, and also highlighting why it did not work, because it's again very important when we think about scaling up certain innovations. And then what challenges were faced in the implementation and how were they mitigated? Again, it's important for that to be brought out. In terms of how documentation was done. So for you to give us data and tell us maybe this particular model worked and contributed to the change in nutrition status, how were you documenting that information? Did you have like, a system? Did you have dashboards? Did you have tools that you used to measure that? It's important for that to be brought out. So key things as you write some of the lessons learned, number one, you need to identify what were the key achievements. Has your model contributed to addressing the problem that it intended? And that speaks to effectiveness. Was it efficient? Was it relevant? Then you come and tell us what worked and what did not work and why. That becomes very, again, important. And if there were any challenges experienced, how were they mitigated? Then as you read your results, after you've written your section, it's important for you to find out, are the results clearly and logically presented? So remember also, as you write the results, you need to align them to the activities that you mentioned. For example, if you did training, certain trainings, were there any results that were related to the training in terms of either improving knowledge or improving practice? And then did the results address the objectives that were set? Was there any new knowledge coming out? And knowledge could be, in this case, in terms of some of the lessons that you're learning in the process of implementation. And the other bit that is very critical is around the relevance. So don't give us results, a lot of results that do not speak to the problem, because again, that will show that whatever it is that you're presenting does not align to the problem. So make sure, as you present your results, align the results to the problem that you mentioned, align the results to the activities that you undertook, so that, again, there's that sort of logical flow. And then in terms of realistic, yeah, it's important for you to present realistic results. So you're not telling us that maybe you targeted to reach maybe 200 children, and in a span of 1 month, you had reached 2,000, that becomes really unrealistic. So even as you present your data, you need to really look at it and be able to check whether it's realistic or not. So lastly, in terms of recommendations, it's important that as you do your best practice paper, you conclude by telling us did your intervention or did your best practice work in achieving the objectives that were set? So that could be in form of a statement, yeah? And how have these results benefited the population? So in the process of you telling us that this worked, are you seeing any results or any impact on the population or any outcomes in the population that you intended? If you're not seeing, again, it's always good for you to mention out and explain why. And again, it's important for you to bring out the key highlights of the best practice, maybe 1 or 2 key highlights, yeah? And this is more of a justification in terms of why should I consider maybe scaling this up. If I were a donor or if I was someone interested in partnering with you in, implementing that best practice, what justification is there that you can put across for you to maybe strongly talk about the best practice that you want to share? And then it's important for you to talk about the scaling up and issues around sustainability, very critical. Can this model be scaled up and to where? So if you've seen this model, for example, work in Turkana County, is it something that can be scaled up to Samburu County? And why do you think so? Yeah. And then of course, in terms of recommendations, what recommendations can be made moving forward in terms of adopting or scaling up this best practice? So in a nutshell, as we talk about a best practice paper, just put in mind, it's more of innovations that have worked. It's always related to a programmatic, information drawn from implementation of a certain project or program, or it could be even a policy. You're trying to analyze the policy and you're looking at policy implementation and you want to check whether maybe that policy has worked very well or it has not. All right. So maybe you can allow me to just talk about a little bit about the scientific abstracts so that we see the difference. And then after that, you can come to questions and answers, if any. So that is more of best practice, more of, information drawn from the programmatic work we do or innovations we come up with or interventions that we do implement. And mostly, if you look at how we generate that data, it's through programmatic data, either through monitoring activities, or it could be through an evaluation, or it could be through a rapid assessment that was done that is now linked to the program that you are implementing. But now when you come to scientific abstracts, and usually these are the most common abstracts, these are abstracts that are now linked to studies that we have implemented. So that is actually the difference. For best practice, you look at programmatic work. For scientific, you focus a lot more on information that is drawn from a study that you implemented. And again, in terms of the structure, usually for the title, it remains. For preliminaries, it remains. For the background here, now you bring out the research problem. What research or statement of the problem? Usually when you write our proposals, we have a section where we describe the statement of the problem. So that is the problem you need to, to bring out in terms of where exactly were knowledge gaps and how is this study intending to address these knowledge gaps? And then you need to also bring about your objectives, research objectives. And usually here, since the abstract is limited in terms of number of words, we usually would recommend that maybe you talk about the main objective so that, again, you don't overcrowd. And then here you describe your methodologies, the methodology that you've used in implementing the study, and you talk about key findings, then you talk about conclusions and recommendations, or sometimes implications of the study. So if you look at the structure, there's a bit of a difference. For best practice, we were talking about a background, then you go to describe the intervention, then you bring in key findings or lessons learned, most probably, and then you talk about recommendations and next steps. But here we have now the background, the objectives, the methodology, and the key findings. So that's the difference. So of course, the preliminaries will not change, but what I'll just highlight on is make sure you read the call of abstract and align to what the call of abstract will tell you, but also have names, the thematic area that you want to submit your abstract to, the author's name, and all of these things just as we've discussed. In terms of the title, again, same thing. The only difference is for the scientific abstract, sometimes it's good for you to bring out the dependent variable. What is the outcome variable that you want to address through the study. Again, highlight the study population and the area. Very important. If you're targeting women of reproductive age, please bring out. If you're targeting a certain county, it's important for that to come out. Sometimes it's good practice to include the study design, but again, remember we are looking at number of words between 20 to 12. So if you find that it's too much, then it's usually not necessary to include that study design or methodology within your title. But key critical things is what, and what is that problem, or what is that outcome I want to address. Number two, who is being targeted in this particular study? Then where exactly is this study being conducted, or where was this study conducted? How is where you bring in the methodology, but based on the number of words, you may also want to leave that ahead. And even as I said, it's still your mini advertisement, because whatever you present in your title will determine whether someone would be keen to maybe listen or learn more about what you did in your study. For the background, mostly we want to bring out the question why. Why did you come up with the study? And what was the main aim of the study? What is the purpose of your study? And remember, here we are talking about bringing out the main problem. What is that main problem that you decided to address through doing your study? It means there was certain knowledge gap. So that knowledge gap really needs to come out very clearly in your background. And as you mentioned, it's important for us to avoid having references, because you'll have them as you do your slides. In terms of methodology, again, key critical things. Number one, who? It's important for you to tell us, who did you target for the study? In terms of the study population, and here you could also, number one, mention what was your study population, what was the total sample size that you are working with, and then the how. It's important for you to bring up the study design, very critical. If it was a cross-sectional study design, if it was a quasi-experimental study design, it's important for that to come out. It's important for you to tell us the outcomes of interest, like examples of variables that you intend to measure within your study, because having that idea of the variables before even coming to the results would give a reviewer at least ample time to be able to read through. So if your study was looking at maybe the effects of a certain model on improving nutrition status, then you need to tell us what were the key indicators that you were measuring to bring out that. Then how was data collected and analyzed? Very important. And here is where you tell us probably whether you are collecting both qualitative and quantitative data, some of the tools that you used, some of the methodology. If it's, for example, a qualitative study, whether you used in-depth interviews, how many in-depth interviews you used, and who you targeted for in those in-depth interviews. Very critical for it to come out. So as much as you talk about the variables, tie them again to the tool and data collection method that you used. And then lastly, speak about analysis. How did you analyze your data? And here we are often keen on looking at details and not necessarily just telling us you analyzed by maybe using a certain software. We'd want to find out, did you do any descriptive analysis? Did you determine any means? If you want to find the difference in means, did you did you use a t-test? Yeah. And then did you do any maybe multivariate analysis, either a logistic regression or not? So all these things really need to come out. So that is for the quantitative part. For qualitative, you need to tell us in terms of how did you analyze the data. Was during data collection, did you do any recording? Did you transcribe? Did you translate? Did you do any coding? What were some of the themes that came out of that particular study? How did you analyze that? It could be through thematic analysis. It could be through content analysis. So that if someone reads your methodology and then they go to the results, it becomes very clear for them. Then in terms of where, it's important that you tell us where the study took place, what was measured here, already highlighted in terms of the variables, and then when the study took place. Again, very critical for it to come out. So as much as there's more details required, there's a way in which as you write the methodologies, key things that you need to ask yourself that should actually stand out. Number one, who? What was the target population? How many people did you sample? How did you sample them? How? What study design was used? What were the key variables that you're looking at? How was the data collected and how was it analyzed? Just in a nutshell. Then where did you conduct the study? Here is where you, briefly describe the area or even just mention we did this in, whether it was Marsabit County or X County, you mentioned. And then when the study took place, very critical. So as you write your methodologies, keep asking yourself these questions and they'll guide you and you'll be able to find out whether you put in adequate information or not. Then for the results section, as we mentioned, based on the methodology that you used, or the type of data that you collected, if it's quantitative data, we expect you to share results based on numbers, it could be proportions, it could be in terms of, p-values, if you want to state whether there's any significant difference or not. If it's qualitative, we need to see themes. What are the themes that are emerging from the study that you conducted? And remember, as you write the results section, it has to align with your title, it has to align with the problem, it has to align with the objectives that you had. So if you're giving us results that don't align to the objective, already that's a ticket for you to, to get a rejection. So it's important for you to think about the objectives that you want to present and align the results to the objectives and the title. And then of course, it should be written in past tense because it speaks to something that you've already done. Be specific with the results. I know as we do studies, sometimes we get quite a lot of results and we are sometimes confused. What do we present? What don't we present? But make sure you have an objective. If your objective is to talk about a certain aspect, ensure that the results that you're presenting align to that particular aspect. Don't go telling us about maybe other results that are not aligned to whatever objective that you put. Then, of course, for quantitative, of course, I've mentioned about having evidence from the data. For qualitative, bring out the issues raised, the themes that are coming up. And sometimes as you do the presentation, probably it's another session we'll have, it's important for you to include quotes of what was said to generate that particular theme. Then for abstracts, it's important for you to avoid tables and figures. So just as guided, ensure you have all the information written down as a narrative or as a text. So tables and figures usually would come as you prepare your slides. Then use active language. For example, we studied 15 people. So the language often matters, and remember that language should be like in past tense because you're presenting what exactly was done. So how do you write the conclusions? So the conclusion should be like a summary or an interpretation of your results. So if you got something to have a significant difference, what does that mean to you? Or what does that mean to the population? What are implications of these findings to policy, to program work? That really needs to come out. What are some of the recommendations that you're making, especially for future research, considering that this is a study? Are there any opportunities that are arising from your study that could inform future studies to be conducted? Usually very critical. And good to note that sometimes it's good to bring out the limitations of your study. Very important. Then key take-home messages. Make sure that as you write your conclusion, it shouldn't be very long. You could have 3 to 4 sentences that speak to how you interpret your results. What's the implication? What do you recommend? What were some of the limitations? So as we write, sometimes as we write conclusions, often we tend to find ourselves repeating the results. So let us not repeat the results, but try interpreting the results and avoid overgeneralization. Limit yourself to the results and the context of what you want to present. Yeah, so in a nutshell, that's what an abstract looks like, a scientific abstract looks like. And you can notice the differences between the best practice and the scientific abstract. So what I'm going to take us through, and I think this should be my final slides, is about the writing process. Usually, how do we write our abstracts to ensure that our abstracts are accepted? Some people would wake up today, take 5 minutes, write an abstract and submit. I want to assure you that if you do that, there's a high likelihood that either you'll get a major revision or your abstract could be rejected. So we have styles of writing or phases of writing that you need to go through as you think about writing your abstract. And I'll just go through the 4 phases. The first phase is about the pre-writing phase. And this is where you sit down and start asking yourself, number 1, what do I want to write about? So think about ideas. And this is where you can do a lot of brainstorming with your colleagues, if you're a student, with your supervisor, and pick a key area, especially if you've done a study. We have a lot of results, but the question becomes, what do you want to present? What is that narrative you want your audience to learn from the work that you're doing? So this is where you do a lot of brainstorming. Then you need, at this point in time, you need to find out, do I have adequate data that would speak to whatever it is I want to communicate? Look at that. Also assess and check what exactly has been done prior to this, so that when I present my results, I'm also able to do comparators. And then now plan the logic of your abstract. So that brainstorming session is usually very important and becomes the first thing that you do. And even as you write, make sure as you think through this, as you brainstorm with your colleagues, make sure you're writing out the key points or key things that you want. So that then when you go into the writing phase, you already have the adequate data, you already have, you know, if you've done a literature review, you have information to refer to. You have maybe adequate information in terms of it's a best practice, some of the key lessons learned, a lot of details in terms of the activities that were undertaken. So that now when you come to phase 2 of the writing, you now put everything in a draft. And this is usually very important. And at this point in time, usually I encourage people to write as much as you can. Whatever ideas come, write, put it down, ensure that all the sections that are required, if it's the background, you have sufficient information. If it's the methodology, you have sufficient information. If it's the results, you've been able to look through and you have the correct results that align. So that becomes the writing phase. And you find that during the writing phase, you have quite a lot of work. So don't worry about the length. The abstract may be about 300 words required. But when you write the first draft of your abstract, you find that it's around 500 words. So that's good for the writing phase. And once you finish the writing phase, make sure you have at least 1 or 2 people to review whatever it is that you've written and give you feedback, all right? So identify experts in the area. If it's for students, if it's your supervisor, for colleagues, if it's people you work with, ensure at least someone reviews the work that you have done. And once they review, they give you comments. And then you revise based on those comments. So that is step 3, where we call the review phase. And lastly, we have now the revision phase. So once you've written your draft, it's been reviewed, you address the comments. Now you come to the revision phase, where you now start cutting to ensure that you align. So you edit, make edits that are required. If the number of words are going beyond, ensure you have adequate numbers included. This is again where you go back and relook at the call for abstract and check, have I adhered to the requirements? If they needed 300 words, it's my abstract 300 words. If they needed you to include maybe, you know, certain sections, you have to cross-check and ensure that you have all that. And then again, read through and ensure that you don't have typos, you don't have errors. And once you're good with that, then you're happy to submit. So if you look at this 4 stepwise process, it's not possible for you to do an abstract in 2 hours and submit and it's accepted. There's quite a lot that you'll miss, but just, you know, training yourself to go through this process becomes very key for you to have very quality abstracts that can be accepted. Some of the reasons why abstract will be rejected is because they are incomplete. The significance of maybe the best practice of the study is not clear, it's not relevant, and it's not probably aligned to the conference theme. For example, if you're talking about primary healthcare and you come in and start talking about maybe, I could pick something in chemistry and you're presenting it and that component is not aligned to primary healthcare, that becomes again a ticket for rejection. Poor scientific content, again, sometimes you find yourself making opinions instead of facts. So it's things coming from your head, especially when you're describing the background. You have to ensure that the background is informed by facts. Then when there's too much jargon, too many acronyms, too many abbreviations, again, it becomes a turnoff. So it's important that whenever you're using an acronym for the first time or an abbreviation, make sure you spell it out. When the context is not well explained, again, I mentioned the importance of including the study area or the area where you implemented the project. So the context has to come up well, because that is the lens within which your audience would be sort of analyzing the results and trying to interpret whatever it is that you're saying. And then too much literature in the background that is not necessary. Yeah, so try and make sure that when you write the background, key thing is what is the problem that either your study or the intervention is going to address, comes out very clearly. So issues around plagiarism, again, become very critical. And this is where maybe you do a lot of self-plagiarism in terms of abstract. So you presented an abstract in one conference, then you want to take that abstract, present in another conference without changing anything. Sometimes it becomes a challenge. And that is what you usually call self-plagiarism. So it's good practice to maybe present an abstract twice, but make sure whatever it is that you're presenting is not the same. Tweak it to align, tweak it to bring out new things that align to the conference. If you submit abstracts in the wrong track, and here we should be very keen on the sub-themes. So make sure that as you're submitting your abstract, you align it to the themes. If abstracts are poorly constructed and written, poorly structured, for example, you're using the format of a best practice paper to write a scientific paper, that becomes, again, one of the tickets to rejection. When there's no novelty, you know, usually for conferences, it's always good for you to bring out, you know, unique things that are working well. So that the novelty of your paper becomes very important. When you don't have evidence to support your findings and you're just talking about opinions, sometimes people would really be keen to find out that. So make sure whatever it is that you present, especially as you present the findings, it's important for you to back it up with data. And then, of course, issues around use of multimedia, use of references are things you may want to check out for. So some of the tips, as I wind up, pay attention to abstract specification, adhere to the word length. If it's 300 words, make sure it's 300 words. Make sure you respond to the theme of the Congress. Write in past tense. Try and use a language that is less complex and make it very comprehensive. Use short sentences, avoid acronyms, and also limit jargons. And I think I come to the end of my presentation and just request whether we have any questions and maybe have a short discussion before dropping off. Over to you, Patrick.
Thank you so much, Yvonne, for that wonderful, compelling, wow presentation, so to speak, that has been widely attended. So we have a few questions in the chat area. I think we can take 5 more minutes before we officially bring this to an end. There's a question. There was an earlier question, Yvonne, on some tips for writing a best title. Whether we could speak about that. And then somebody else is asking. This is Tegefu is asking, while writing the abstract, is it mandatory to specify and write each title and subtitles as outlined? Those are the 2 questions so far. And then I think I want to open it up. Those who have some burning questions, you could be able to ask. We shall stop officially at 11:17. Yvonne, you could respond to those ones. Hi, Yvonne. Then we have Joshua Limo and Nicholas. Yvonne, can you hear me? Not sure whether Yvonne can hear me. Hello, Yvonne.
Yes, thank you. You had actually muted me completely.
Sorry about that.
I was not able to speak. Sorry about that. Yes, okay. I was saying, yeah, thanks a lot for the questions. And I think most of them relate to the title. So I didn't get that question clearly, but it was asking, how do you write a compelling title?
Yes.
Was that the question?
Yeah.
So as you said, when you write the title, of course, yes, you have to make it compelling. However, there are critical things that we said must be there. Number one, the what, if it's a model. If it's a study, what variable do you want to address? Where and who. Those are the three main things. How do you make that compelling? It depends on how you want to write it. Sometimes we do even accept titles that come in form of a question. When you pose a title in form of a question, it gets the reviewer thinking, and they become eager to read what it is that you want to share. Then bringing out the novel component in your abstract. What is that new thing that you want to share? Yeah, that could be also another way of making it compelling. And when you talk about novelty, we're not talking about innovation, like you look at them as innovations. It could be, for example, someone has done a study somewhere and they targeted pregnant women. And then they've done a similar study in another area and they've targeted women who are not pregnant, and you're seeing different results. That could be one way. So bringing out differences even in study population, differences in context, could be ways that you could make your title compelling. So those would be the few things I could highlight around that. But trying to pose it as a question sometimes becomes interesting, but make sure that the question also aligns to what you really want your audience to get from this particular presentation. Then there was a question on, while writing best practice abstract, is it mandatory to specify and write each titles and subtitles as outlined? Yeah, thank you, Degefu, for that question. Remember when I started, I talked about types of abstracts, and I talked about the styles of writing, whether it's a block abstract where you write everything in continuous prose as one paragraph, or a structured abstract where you have now those subtitles that you need to respond to. So this is usually guided by the call for abstract. And if you look at our call for abstracts, it's actually a structured abstract. So you'd expect where they've written, for example, background, you still include that background name and then put in the details of the background. If it's on implementation of the intervention or the best practice, again, you'll have that. So always be guided by the call for abstract. Check whether they want a block abstract or they want a structured abstract. But for this case, whatever it is that you're requesting will actually suffice. It will become mandatory because the style of writing here is the structured abstract. I hope I've responded. Over to you, Patrick.
Yes, Yvonne, we have some more questions. Someone is asking, this is Onyango, how do you balance between abstract and full conference paper? So that is one from Onyango. So don't mute Yvonne, so that I don't again have to struggle. And then somebody is asking, would it be nice to show how to translate abstract into manuscript, especially the non-scientific abstracts? Yes, and Limo, you are spot on. We are also going to publish good manuscripts out of these abstracts at the end of this Congress in our AMREF International University Journal of Primary Healthcare. So we shall be giving you more updates about that in our website. So be sure to keep in touch through either our email that I have shared or visiting our website. Yvonne, would you want to talk about that?
Absolutely. Patrick, I'm happy to speak to that. So how do you balance between an abstract and a full paper conference? A full conference paper, yeah. So as I mentioned from the beginning, when you're writing your abstract, it's actually a summary, and you have to summarize like your paper in 300 words. And if I read that abstract, it has to give me an idea of what your full paper is. So when you talk about a full conference paper, this is something that comes after your abstract has been accepted, and then probably the abstract will be published as a manuscript in the journal. Just as Patrick has said, this could be one of the things that we'll do. So you may have a paper that you've developed before, and you want to summarize that paper. So that will become the abstract. But for a full paper, again, in terms of format, the formats are different for both best practice and scientific papers. And this again will be guided by the journal that you want to submit to. And if you look at the requirements in terms of length, if you're writing a full paper, then each of the sections you'll be required to give a lot more information. But for the abstract, it's like just a summary. a summary in very few words, in 300 words. It's like you're trying to describe what your paper would be about. So if you look at the format, sometimes they are somehow similar, and I think that's where Zablon is coming in, but a full paper has more details, usually up to around 18, 19 pages, where you're now elaborating each of the sections in detail. But also you'll find that when you're writing a full paper, at the beginning, again, you have an abstract that summarizes that. So I'm not sure if I've really brought out the differences. Please confirm to me, Zablon, about that. You could just type in the chat. But ideally, a paper is now presents more details of what you would have presented in an abstract. But an abstract summarizes everything in very few words. Yeah. The other question?
Yeah, the other question was about structuring. Whether structuring the abstracts or in prose.
Structuring the abstract in prose.
I mean, either structuring by way of subtitles or writing in continuous prose. Someone is asking, which one is which? Which one is yeah.
And that's I think what we discussed in the first question, that we'll use the structured abstract. We won't write in continuous prose, but we'll use the structured, just the way it's been spelled out in the call for abstract.
Yes, and actually,
yeah, then I see Joshua Limo has said it could be nice to share how to translate an abstract into a manuscript, especially the non-scientific abstracts. So I think, yeah, that could be another session we can have. And that's a session on how to develop best practice paper if it's non-scientific, all right? It's a whole training that now brings in the nitty-gritty details that you need to consider when you're developing a manuscript for publication. So probably something to consider for future sessions, Joshua, because I may not be able to go deeper into talking about a manuscript at this point in time, but just understand an abstract is a summary, a manuscript has more details. And a best practice paper would have a different, a best practice manuscript would have a different structure compared to a scientific paper or a paper that is drawn from a study. And often that is guided by the journal that you want to submit your paper to. Yeah. Patrick?
Thank you so much, Yvonne. We want to bring this session to an end, but I think we shall bring it to an end in style. We just want to allow one person, this is Nicholas Obonyo, to represent those who wanted to speak, because we have really overrun our time. We can't continue further than that. So I shall only give to Nicholas to just ask your question quickly. So Nicholas, if you can be able to speak, and then we can be able to wrap it at that. But again, to just, as Nicholas is preparing to speak, to just say that we are going to have another abstract training session. It's going to be done by Dr. Dan Onguru from JUST. We are going to be giving you the full dates for this. It should be before the deadline for the abstract submission. So please stay tuned through visiting our Congress website. For those of you whose questions were not answered, that would be another place to have your questions answered. Please understand, we have really overrun our time. And thank you so much for everyone who has attended. But I want to allow Nicholas to ask the last question before we wrap it at that. Nicholas? Nicholas, go ahead. I have unmuted you. Nicholas, are you able to speak? It seems he's having challenges. So unfortunately, again, we cannot be able to continue further than that. I want to thank all the organizations. I can see more than 10 organizations have been here. Egerton University, Methodist University, KMTC, Amref Health Africa in different regions. This was excellent. Thank you so much for attending. Of course, JUST, many other organizations have been able to attend. Amref Health Africa in Tanzania, AHA, a number of organizations having participated in this inaugural training. Adolescent Health Impact Initiative have been here, USAID AMPATH. Thank you so much all for attending. And with that, we bring the session to an end. We shall be able to share the the training video and also the slides. Thank you so much. And thank you so much, everyone. I'll see you soon. Bye.